Why is catheterization needed for post-void residual volume testing? Imagine trying to find out how much urine is left in your bladder after you go to the bathroom. That's what post-void residual volume testing is all about. It helps doctors see how well your bladder empties. To get an exact measurement, they often use a small, flexible tube called a catheter. This is because catheterization allows for a direct and precise way to measure the remaining urine. Sometimes, ultrasound devices are used to estimate this, but they can be less accurate. The catheter is inserted through the urethra into the bladder after you urinate, and then it drains the leftover urine. This method is considered the most reliable because it physically removes and measures the urine left behind. Catheterization is especially helpful when a doctor needs a very accurate measurement to understand your bladder function better. For example, if there is concern about urinary retention, which is when the bladder does not empty properly, this test can confirm the problem. It is also useful if a urine sample is needed to check for infections that might be causing retention issues. Sometimes, ultrasound scans might not give clear results, or they might be inconclusive, so a catheter provides a definitive answer. While bladder scanners are a non-invasive alternative and are often preferred because they do not involve inserting a tube, they are not always enough. When precise measurement is critical, or when sterile urine samples are needed for testing, catheterization becomes necessary. It is important to remember that catheterization does carry some risks, such as discomfort, injury to the urethra, or urinary tract infections. Because of these risks, healthcare providers usually use this method only when other options are not suitable or when accurate data is essential. In the context of bladder health and bladder cancer, measuring residual urine accurately can help detect if there is an obstruction caused by tumors or other issues. It can also help assess how well the bladder is functioning after treatments or surgeries. Monitoring residual urine helps doctors understand if the bladder is emptying properly or if there are complications that need attention. In summary, catheterization is needed for post-void residual volume testing because it provides the most accurate, direct measurement of leftover urine. It also allows for uncontaminated urine samples when necessary and helps in diagnosing and managing bladder problems, including those related to bladder cancer. Always consult a healthcare professional for personalized advice and to determine the best approach for your specific situation.